Okay, so we're going to take a look at the upper cross pattern, which is super common. And you'll see it when folks have, what are the primary postures you see going on here?
Their heads forward.
Head forward, definitely. So her external auditory meatus, the ear hole, if the head is not forward, should go over the shoulder.
Wow.
Right around the acromion. She has an extreme head forward posture. What else do you see going on? Was your hand up?
I was just saying protraction. Is that what you call it? Protraction?
Protraction of the scapula. Yeah, excellent. And Kat?
That's what I was going to say. But her rhomboids is overstretched?
Yeah, so let's look at the overall pattern and then, let's talk about the muscles. So protraction, as a review, is when the scapula, I've got the wrong one there, when the scapula moves too far forward, right? And what's another name for this common part of the pattern?
Like humpback or hunchback?
Right, so the hunchback and the hyperkyphosis is this part of the pattern when there's an excessive curve in the thoracic area. And then what's happening in the shoulder part of the pattern, which so many of us do when we slouch. Yeah, Kat?
They're internally rotated?
Excellent. So we've got an internal rotation, in other words, a medial rotation. Excellent. And so this puts a great strain on all of our rotator cuff when we throw ourselves out of line with gravity. So the more in line we are with gravity, the less those muscles and ligaments have to do to stabilize this glenohumeral joint. So very good. We've got our hyperkyphosis, we've got our internal rotation, and we've got our scapula. They're going forward, and we've got our head forward posture. So we've talked about some of the muscle pattern before, and what you have in front of you for this worksheet specifically calls out the upper cross pattern of what's stretched out long and weak is on this part of the cross, and what's short and tight is on this part of the cross. What I'd like you to do is to really think about it, and as you're looking at it and analyzing it, about what movements are going to cause these to be short and tight, and which ones are going to be causing them to be long and weak, because you're going to constantly be looking at your patients like this. As soon as they come in and they don't know they're being posturally analyzed, the way that they walk in and the way that they sit is going to be even more natural, and you're going to see what they really do. And even when they're filling out their form, you're going to see what happens when they naturally do paperwork. And you can start looking at what, while this one is super common, you can really look at what is going to be stretched, long, and weak, and what is going to be short and tight. So part of what I want to call out on this, and then I'd like you to call out muscles in a minute, is looking at the muscles. Of course, we know they shorten to pull to do their job. So we can see where on the body could the ones that pull the scapula forward, where is my hand having to pull these forward from? I see people pointing right to the front. So you're going to be looking at your muscles that are in the front, like which ones around here? Pecs, excellent. Pec major, pec minor. And then a lot of people forget, I'm sorry, what's that?
Oh, the teres?
Teres.
Oh, we're in the back. Never mind. Just ignore me.
Well, there's two teres, and one actually internally rotates and the other externally rotates. So we do have some teres action here. What else? People often forget right here, pulling forward. So what do we have right here pulling?
The deltoid?
Excellent. So the anterior deltoid, right, is also doing that. Now, commonly, of course, we're also raising. So what direction here can pull this up and over? That is going to be, that's going to be attaching up front, but good thinking because it's in the right neighborhood. Levator scapula, excellent. Who else is up here and attaching to here? Traps, excellent. Excellent. So anything like that is going to be short and tight. And then you can tighten up, right, and see your scalenes as well. Subox. Okay, now we're looking at the part of the pattern right here. So far we've been looking at the scapula. But when we have this head forward, go ahead and do this yourselves right now. A lot of us do it anyway, but whatever your natural posture is, exaggerate the head forward aspect. So for me, that would be like when I'm texting. And so if you really lean forward, go ahead and get into that posture.
Yeah,
And then right your eyes.
You're looking like the lady.
Thank you. Because she looks really sad, so thank you. I've mastered this posture. So do this for a while.
It hurts for you though.
It does hurt. And where do you feel the tightness? I see a lot of people pointing to their suboccipital area, the top of their shoulders. So there's an interesting thing called the writing reflex where your eyes have to, no matter how far forward your head goes or how tilted you are in your posture, your eyes still have to be able to focus right on the horizon. So like, let's pretend she was driving and she's that far forward. She's still got to, oh, that really hurts. She's still got to keep her head up, and so these muscles in here get really tight, right? So now we're looking at her subox. Her scalenes are really tight. Her sternocleidomastoid is really tight. And of course, upper traps, right? We already talked about that one. So massage is especially good, right, at lengthening the short and tight. What are some of the techniques you already know how to lengthen the short and tight?
NFR.
Myofascial release, excellent.
Pin and stretch.
Pin and stretch, excellent, thank you. What's likely to develop in the short and tight overused ones?
Trigger point?
Trigger points, excellent. So all our techniques to release the trigger points, right? And you're already thinking about lengthening, right? Because you mentioned myofascial release, you mentioned pin and stretch, any of the stretches. And then also linear friction. So things that are really going to lengthen. But do we want to lengthen the things that are already long? And let's take a look right here. If this scapula moves forward, what gets long and stretched right here?
Rhomboid.
Rhomboid's excellent. And then what's the most superficial muscle on top of them right there? Middle traps, right? Middle traps. So we don't want to release what's messed up here in a direction, right, that's pulling it even farther forward. But we can, it's still going to develop trigger points likely. So we still want to release those, but we want to go more in a cross fiber direction version. Now, for today, we're going to focus on the cupping version of what we can do on that. And another day, I hope we add in the kinesiotaping, because that can either work in a direction that helps stimulate or activate the long and weak ones, as well as work with the ones that are short and tight. But what makes the muscle, having a hard time how to word this one, what would be the best way to get the person to activate their muscle and use their muscle if we've already released the ones that are holding it forward? How can we get this muscle to actually do its job again and pull these shoulder blades back? Yeah.
Mobilize it.
Mobilize it. Great. Excellent. And what else gets the muscle to actually do its job? We want these shoulders back again.
Concentric.
Yeah, excellent. So actually having the client do active movements, right?
Right.
So massage is excellent at the short and tight stuff, right? And we need to release the short and tight stuff and the trigger points to allow these movements to occur again, right? And the fascia. But then we need to actually stimulate those muscles, and the best way is actually to have the client do those motions. So we're going to have just a quick other look at this shoulder and scapular movement. Could you turn the light back? And we'll turn this off. Yeah, and just face the board if you don't mind.
Is that?
Yeah, lights on, please.
Oh, all of them. Oh, gotcha.
Okay, so we've looked at a lot of what's going on here as far as can you round your shoulders? So here's her, elevate, okay, how about round them forward? We're gonna go hyperkyphotically, just like you have a medial rotation. So her shoulder blades were out here, and now she's pulled them out here. Oh, that looks like we don't want to keep you in there that long. So that's what's going with hyperkyphosis, and then go ahead and bring them back down and then relax. But and someone mentioned scapular mobilization. Let's take a look again at what this shoulder can do with or without the scapula. So we're going to have the client abduct to 90 degrees. As a review, that's as far as she can go, anybody, without using their scapula. So to go any higher, see how that scapula has to do its job? So to add a layer to our postural assessment and our movement assessment, you can take a look at the client's range of motion and how the scapula and the glenohumeral joint work together and where any limitations are in there. So Lucy, can you raise your arm over your head and let's take a look and how far you can go without pain. And we can see that her scapula is able to travel up, and then go ahead and relax. And of course we could compare signs. Yeah, and I see you doing that yourself, so that's great. Thanks, Lucy. Are there, so in today's lab we're going to focus on a cupping approach to this. And last week we focused on more relaxation cupping. Today we're going to add in layers of how to work with the trigger points and pin and stretch and so forth. And then next week Lucy's going to do a demonstration on a different approach without the cups to this hyperkyphosis. Because you're going to see this in a huge number of your patients. And they are very often not going to come in complaining specifically about their posture. And they're very often not going to be saying they want to improve their posture, but many of their aches and pains are directly related to their posture. So you're putting that all together yourself, even when they don't say, hey, I slouch, I've got bad posture, I want to improve it. But you're seeing instead what kind of symptoms are they likely to have. If they're like this all the time, what kind of pain might they complain to you about?
Oh, pain in the upper back?
Pain in the upper back, thank you.
Shoulder pain.
Shoulder pain, thank you.
Right.
Headache.
Neck pain, headaches.
Lower back too.
It could even affect the lower back. It compensates often. Excellent. And we're going to study this next one kind of in a next level injury evaluation and treatment. But because of that scalene and sternocleidomastoid and pec action, we can even get symptoms down the arms, whether or not it's diagnosed as thoracic outlet syndrome or carpal tunnel syndrome. Some of these problems can radiate as well. Any questions before we get to a demonstration?
Does kyphosis affect, well, I mean, not kyphosis, more about the shoulders, the scapular protraction. The little guys in between the...
Rotatories and multifidi?
Yes, thank you.
Yeah.
How does it affect those?
That's a great question. So if you, with the scapula protraction, and then of course we have the medial rotation with that, but of course that often also goes with the hyperkyphosis.
Mm-hmm.
So when we have an excessive curvature here, that puts a little stress or strain on each little facet joint. And so that's exactly going to put more tension on those rotatories and multifidi.
Mm-hmm.
And so you'll see that a lot too, you know, of course, with folks going to the chiropractor and they've got the little vertebral subluxations. That's integrally related to this as well. So that they often do get involved.
Okay.
Yeah. And oftentimes if you can just work at least a couple segments above and below the problem, that can be helpful. Yeah. Great question. Any other questions or observations or add just one tiny more piece. I noticed, because I do that posture a lot, the slumping more than head forward. I have a little bit of head forward, but more of the rotation. One thing that I think is so great about this work, and our other teachers here might want to add something as well, is that, you know, a lot of people, when they think about improving their posture, or they just try to do it on their own, there's a lot of stress and strain trying to sit up better if you have the trigger points and tight myofascia and kind of all these built-in patterns, and it becomes this very sort of rigid, stressed project, right? But once you, as the massage therapist, really helps open up the fascia and release the trigger points that are all involved in the pattern, the client all of a sudden has this very new and different relationship with this opening that then feels very natural and possible. And of course, they may go back to their old patterns depending on how they use their phone and sit at their computer and so forth. But it gives them an opportunity for that opening, and then they can either continue in a good direction with stretching and exercises, or go back down that road if they don't change any of their, postures. Lucy or Jill, do you want to add anything?
The only thing I would add, and I'm sure we would all agree, is that we actually are seeing more of this now because so many people are working from their homes, and the setups they have at home for work are not ideal. And they also actually have less movement throughout their day because they're not walking to their car, they're not, walking to the cafeteria, they're just home. And when I ask people often, like, oh, well, where do you work at home? Well, I sit on the couch, or I sit in my bed. And so all of those things really contribute to this problem. And I'd say it's at least 80% of the people.
Just told me that, like, literally just
Yeah.
saying.
Yeah, thanks for bringing that up, Jill and Brittany. And
throughout the day.
yeah.
Right.
And I noticed it for myself that in the first quarter of COVID, I felt sort of lucky to get to do a lot of my computer work from the couch. And I thought, oh, this is so relaxing to do my work on the couch. And I had all these like aches and pains, and I was like, oh, actually my body hates this. So I better go sit at I don't have a separate office or a desk or anything like that, but I have a better setup at my kitchen table than my sofa, which sort of eats you like a cozy sectional. Yeah. Do you want to add anything, Lucy?
Yeah, as our,
Go to
we are RMC, like massage therapists, we always pay attention about our posture when we give the pressure to the client. Only we do like that, and it will make our posture is become like hyperkyphosis. So pay attention like that, and only after any session we do stretching on the arm behind on the back, and we just pulling like that. It helps for our muscles here is getting longer and helping our muscle here getting shorter for balancing on the body after any session. So I just want to add that.
Thank you for adding that, Lucy. And I find when I do massage too, because so much of it, right, exactly like Lucy is saying, is like this. That's part of why I love to do any movements that are pulling, like when we reach on a client's back or hip and use our whole body weight to sit back, like anything that you can really pull back. And that's excellent stretch Lucy's talking about. You can also do that in door jams. I'll do that when I'm waiting for my client to get ready. If I'm ready before them, I'll use the wall or a door jam. And because the pec major fans out, I fanned it out opposite. It fans out like this. To get the different fibers, you really have to stretch up and medium and back, right? So you can do that in different positions, but you want to get all those fibers, yeah. Throughout your massage day, right? Like not just at the end of it.
Sometimes we can do like that.
Oh, nice. Nice.
Yeah, that's for movement of our spine.